Thank you very much. I'm as co-designer of the Beacon API and the model and so on, I'm still shaking when I see the things that are happening that we don't know about. And this is very nice when you see something you have created some years ago to start moving and to start being used and tested and so on. Okay, so still shaking, thank you. So I'm presenting today just a small thing related to the Beacon ecosystem. We have now our RNA-seq extension of Beacon, so this is doable. We are talking about including images in Beacon with different types of images, radiology, radiomics, pathology. So we have several groups working on that of course are outside of our own bandwidth. I'm sorry because I didn't start my timer. So yes, this is a live thing. So what I'm presenting today, sorry, going back. This is a work we have done together with some people that I today here, Alberto and Aurora are here. Some of the people has been working on that together in order to develop a Beacon interface on top of the OMOP CDM. So very similar to what Alexandrina has presented, but instead of using just genomic things, here we forgot everything genomics and just go to phenoclinical data, okay? What's in OMOP is what we want to expose. And these are the, oh, sorry, I'm going too fast. These are the three institutions that have been mostly involved in the development of this tool that is the Beacon for OMOP. So these are different sections of the speech. Global Alliance is the owner of the specification. And as I was saying, I'm a co-lead of this group. And I would say probably the main designer. So all the faults in the specification are mine. All the beauties are the team correcting me. So please thank them. Global Alliance is an association and an organization that is trying to standardize everything related to genomics and health, but health also, okay? So they try to integrate things from everywhere in order to make the genomics more useful. What is Beacon? Alexandrina has explained that perfectly. The idea of this is that you can query something. In this case, the genomic model, what we have includes genomics and also phenoclinical features. And this is a clear example. You go to a Beacon interface. If you are a machine, you go to the Beacon API, of course. You sign in if this is necessary, not always required, of course, depending on the data set. You have a query to run, and this query in this case is the number of patients with a mutation in a given place, and then the Beacon response, that many is what we have, okay? So that's the idea of that we're trying to do some privacy preserving thing, because we never give you the details unless you are authorized, and if you are still more shy than telling a number, you can say only, yes, I have something related to that. And if you want more, here is the contact, or this is the procedure to get more information. Okay, so which are the Beacon strengths? The Beacon strength, I would say, is simplicity. We try to be very simple. It's very light. So it's most of the cases just an API facade on top of something. And it's made on the consciousness that the data we are dealing with is sensitive. So you want to be cautious on what you are showing, how you are not, what you are not showing, and so on. So, and then we focus on the incremental deployment or development, if you want, of your own Beacon. This is the first column on your left. That is, Alexandrina has shown that, is we are interested in just one specific query. We have valuable data for this thing, so we expose just this thing. We don't care about anything else at this point in time. As soon as they want to distinguish between mutations in men and women, they could add this in their semantic query. And when they want to distinguish that by age, they can add that to the model, to the database, or to the filters that are accepted by this specific Beacon, okay? So it allows you to increase as you see value on what you are doing and you see utility and so on. Security, I mentioned that. Filters, the filters are based on ontology terms, the same way that Alexandrina has shown that you do a Sparkle query and this ends up in something that is a BCF, that is a text file, and retrieve the results from there. You can do the same thing. You can do a semantic query, an ontology query, sorry, in this case, and translate that to something that is not semantic like the OMOP CDM, okay? So Beacon does these things, so you don't need to do all the harmonization in the backend. You can do that in the Beacon. And of course, if you need to harmonize everything, then you have seen the previous talks that this is super complicated, and that's the reason Beacon is incremental. You want only to map 3 terms, it's fine. 1 term, it's fine. 100 terms, it's fine. You decide what you do, okay? And then, of course, there is no HL if you don't want to do that. That's the idea of a SAT. Another important strength is that Beacon is designed to be part of networks. The same way that in OMOP you have the atlas and you can have a network of atlases, then here you have a Beacon network that you can run the query on top of this Beacon network, and then this is spread around the world, and you get the results from all the beacons that are alive at that moment, and then you can see which of them could be of interest for you. In this case, for example, here it's clear that if you want to do an analysis, maybe this is the cohort you are wanting to have. But if you need 3,000, maybe you need to join all of them together, and then you enter in this other world of problems. So beacons in real life, I don't need to say anything. Alexandrina has said everything. I was tempted to use your presentation, Alexandrina, and do comments on top of it. And one example I want to show is that we have beacons in many places, but in particular here, we have one beacon that it's called the Marató from a hackathon, a telethon that it's done on Christmas here in Catalonia, and l'Hospital de Sant Pau and la Fundació Puigverd that are close here are members of this beacon network. Then we have a Spanish level impact data. It's hospitals and institutions around Spain. And now in the European genomic data infrastructure, Beacon is the interface also for doing queries. You have a portal, the portal is doing queries to the Beacon, and Beacon is returning the results, okay? So we have plenty of places where this is happening. So, sorry, wrong button. So, yes. In particular, how this applies to OMOP, as I was saying, incremental deployment, as repeating myself, but applying that to OMOP. You can increment the number of OMOP concepts that you are exposing to the external world, the number of domains if you want, and so on, okay? So, and this could be the filters that you will use in your queries. Security means that you can provide different levels of authentication and authorization. This is not part of the spec, but is what everyone is doing in their own beacons. And then you can provide granularity on the responses. I only respond to Boolean if you are not authenticated. I respond with counts if you are authenticated, and I respond with details if you are authenticated and authorized, okay? So you can have control on this thing. Filters mean that you accept OMOP contents if you want, and you can do mappings also to other ontologies to the OMOP vocabulary. Not as in the example that we have seen before, because ICD-10 and SNOT are part of OMOP already, but if you have a vocabulary that is not part of OMOP, then you can use that as the query term and map it to OMOP using the beacon layer. And integration, as I was saying, this is just the thing that we have been doing, okay? So which are the modules, the components of this beacon for OMOP implementation? We have a web user interface, we have a Beacon v2 compliant REST API, we have a Python API server implementation, we have a new implementation. What Alexandrina has used is the reference implementation, but this was more designed as an example of how you can implement Beacon and how you can do something with Beacon. Now we have another thing that is called production implementation, that it's meant for putting beacons in production and has more logs, more control on the configuration, better split of the different layers on the tool, on the solution, and so on. Well, we have then the Postgres OMOP CDM, not CMD, sorry, CDM, my fault, a mapping layer between the calls and the SQL queries, similarly to how they have mapped Sparkle to Beacon. In this case, we map Beacon to SQL, okay? And last but not least, we have a synthetic OMOP CDM dataset that has been generated for demonstrating that and testing. And this is an example of this thing. You have the user on your left, and then it's calling the API. This could be through user interface, of course, a web interface. And this is part of the schema that Beacon has. In particular, in this OMOP implementation, we only implemented, Alexandrina mentioned the 7 endpoints that we have in the default model. This is not genomic variants. You can see these are the 3, that it's individuals, biosamples, and cohorts, okay? This is using a map to map these schemas, these JSON schemas into the model domains, into OMOP CDM, and then the query is built on the fly on top of the tables that the OMOP CDM is having, okay? So the concept is quite simple, and it's straightforward. Not easy necessarily, okay, as we have been demonstrating so far. And these are some links and references. In particular, I will point you to this paper that we have written some time ago on demand that is explaining you how you need to plan if you are considering having a beacon, what you need to take into account. And you will see that the first steps is know your data and which is the value of your data, why your data set is interesting to the rest of the world, and then have the buy-in from the stakeholders that they will tell you, yes, you can deploy this server here, you can use our data, everything legal and ethical is ready, and you can go on. And then you start really working on that incrementally, as I was saying, not try to do everything at once because you will be dead very easily. And here you have the PI, meaning the production implementation. There is a branch. We are updating the OMOP implementation in this branch together with the BSc, of course. And then this is the previous version that it's on top using the reference implementation the same way that Alexandrina was mentioning before. And with that, I'm done with this part of the slides.
Thank you for your presentation. Very interesting. I am Miguel Pereira from Better. My question is about the compatibility between Beacon and OMOP CDM. If I am not confused, because I didn't work so much with Beacon, Beacon is not specific for secondary use. It is also for query data for healthcare and for primary use of the data, not just related with the research, and it's also for query data for healthcare purpose. But OMOP is a model designed for secondary use, mainly for federated research, etc. So I have two questions. First one is in some way OMOP CDM, because this secondary use design limiting the powerful of the API based on Beacon? And second one, you are also, or the Beacon community, planning to develop the API on the top of other standards like OpenAir or FHIR or others, especially OpenAir because of the persistent purpose? Thank you so much.
Okay, so for OpenEHR, we don't have tested anything. For FHIR, we did a hackathon a couple of years ago, and in 1 week, we had a Beacon working on top of a FHIR API, okay? So this is much easier than OMOP because you are leveraging JSON that FHIR API is returning you, okay? So this is easy. In terms of the previous question, Beacon is not especially designed for primary or secondary use. It's designed for sharing data. Sometimes the frontier between primary and secondary use is blurred, and this is a discussion we are having with many lawyers, because if you are a clinician looking for an allele frequency in NOMAD, for example, you are doing primary use or secondary use of this data. Well, it's sometimes probably you'll have the debate. So the main difficulties, if you want, when mapping from OMOP to Beacon and vice versa, is not that big. It's mostly that Beacon is based on some standards that are meant for sharing information. One of them is phenopackets. So individuals and biosamples mostly come from phenopackets. And phenopackets is originally oriented to rare diseases and oriented to phenotypes. That it's something that is lacking in most of the electronic health records. Okay? So probably this is the only place that the not totally overlap of the domains that both things are covering. Of course, OMOP has nothing about genomics, so this is completely out of the scope, and nothing about imaging, I would say, probably, unless you use the radiology extension, one of the existing ones, okay? So this is probably the main difficulty. Alberto has been working on that, probably more hands dirty than myself, so maybe he has something to comment on that later, yeah?
Thank you for your presentation. Since the EHDS is coming up, and this is one of the interesting parts, I'd say, of the EHDS, are you also looking into integrating with access policies, etc., formats like ODRL to facilitate this?
Yes, I would say that I'm an engineer, let's say. Well, I'm a biologist and an engineer in my life, okay? So when we are talking about something that will come, usually I'm kind of not a skeptic, but I'm kind of wait and see, okay? Before saying, yes, we can do, or we will do, or we will not do, I prefer to wait a little bit to see exactly how this develops. However, in things like the GDI that I mentioned before and so on, there is a strong interest that all those things are aligned, and this means that they will drag us into this thing we want or we wanted to do it, okay? So yes, one it's not exactly the same thing, but as an example of that this is happening, we now are experiencing using Beacon to share metadata, DCAT AP, for example. Okay, so in Beacon you will be able, apart from the real data that you have, to be able to query or get information from DCAT and so on. So it's moving in that direction. I could not do any promise on that, but it seems that we will go there also. Yeah.